Hey, Chani Moniker, developmental audiologist here. That means I help you facilitate development and optimal learning. Let's address the pink elephant first. You may be wondering why a developmental audiologist is talking about parenting rather than hearing and listening, like most audiology channels. Great question. I'm on a mission to make the learning process easier. As someone who is trained to deal with the hearing impaired, I was taught to focus on listening as a communicative relationship between listener and speaker. Each one has their role and responsibility for successful communication. It occurred to me that education, at its core, is a communicative event with a speaker and a listener. In this situation, we want the educator to be the main speaker and the student the listener. I help improve the education process by doing assessments at the Hearing Kids Clinic to see how well the listener's physiological function, their body, serves them to listen. And I do parent and teacher trainings to help these educators be better speakers by providing an understanding of their audience, the individual student who is not understanding what the educator is trying to communicate. Let's imagine, if you will, that you were speaking to somebody who's British, but didn't know it because they adopted the American accent so well. The subtle language differences would make for some very interesting, unexpected outcomes, and you wouldn't know why or how you need to adjust without learning this person is really British, or Australian, or African, right? There are actually a lot of countries that learn English, but with subtle differences. And if we don't have the expected cues, we don't know how to fix the problem. Well, if you aren't getting the results you expect when educating your child, be it as a parent or a teacher, then something is getting lost in translation. My trainings are to help you recognize these cues, these red flags, so you know where to look and what to look for. So let's get started here by looking at what expectations you have and what knowledge and beliefs you have about parenting and child development. So the question is, how does bilingualism affect cognitive development? And the options were, it confuses children, it has no effect, or it enhances cognitive skills. And the answer is it enhances cognitive skills. Based on what we know about language development in the hearing impaired, the belief that language learning years is birth to 4 years old is not quite true. If a child receives a cochlear implant at 3 years old or later, I can hear the difference. If a child receives their implant before 2 years old, without seeing the implant device, no one would ever know. So teaching a young child multiple languages as early as possible makes it so much easier for them to learn the languages. The caveat would be a child who is diagnosed with a language disorder, which wouldn't be in the first few years anyway, as this is not the same as language delay. But in the case of a language disorder, your speech therapist may advise you to focus on one language.